For 3 years, no one questioned the strange shadow in the patient's scans. It looked like an old surgical implant until one radiologist zoomed in and realized it was a gun barrel. What would you do if you discovered that your trusted doctor had used your body to hide evidence of a crime? Share your thoughts in the comments below. Dr. Sarah Kim had been working as a radiologist at Metropolitan General Hospital for 12 years, and she thought she had seen everything that could possibly show up on a CT scan. Tumours, foreign objects swallowed by children, surgical instruments accidentally left behind during operations. The human body seemed to have an endless capacity for harbouring unexpected items. But nothing in her extensive experience had prepared her for what she was about to discover on this ordinary Tuesday afternoon. The patient was Marcus Thompson, a 34-year-old construction worker who had come to the emergency room complaining of severe abdominal pain that had been worsening over the past week. Thompson was a regular at the hospital, not because he was particularly sickly, but because construction work had a way of generating injuries that required medical attention. Over the past 3 years, he had been treated for a broken arm, several deep cuts that required stitches, and a concussion from a falling piece of equipment. Dr. Amanda Chen, the emergency room physician who had ordered the scan, suspected appendicitis based on Thompson's symptoms and vital signs. The pain was localized to his lower right abdomen, he had a low-grade fever, and his white blood cell count was elevated. All classic signs of an inflamed appendix that needed surgical removal. Typical appendicitis case, Dr. Chen had noted in Thompson's chart. Patient presents with classic symptoms, recommending immediate CT scan to confirm diagnosis before surgical intervention. Dr. Kim pulled up Thompson's scans on her computer, expecting to see the telltale signs of an inflamed appendix that would require emergency surgery. The hospital's imaging system displayed the cross-sectional views of Thompson's abdomen in crisp detail, each slice revealing different anatomical structures with the clarity that modern CT technology provided. But as she scrolled through the images, something caught her attention that had nothing to do with his appendix. There, nestled in the soft tissue of his lower back, was a distinct metallic shadow that shouldn't have been there. The object was long, narrow, and cylindrical, about 6 inches in length and clearly metallic based on its density on the scan. Dr. Kim frowned, clicking through Thompson's medical history to see if there was any record of previous surgery that might explain the presence of a metallic implant. Sometimes patients received metal rods, plates, or screws to repair broken bones or damaged joints, and these would show up clearly on CT scans. But Thompson's medical records showed no history of back surgery. No mention of any implanted medical devices, and no indication that he had ever received any kind of metallic implant. The object appeared to be embedded in the muscle tissue of his lower back, positioned in a way that suggested it had been placed there deliberately rather than being the result of an accident or injury. "That's odd," Dr. Kim muttered to herself, adjusting the contrast and brightness of the image to get a better look at the mysterious object. The more she studied it, the more convinced she became that this wasn't a standard medical implant. She pulled up Thompson's previous scans from his earlier visits to the hospital. The broken arm from 2 years ago had required X-rays of his upper extremities. but those wouldn't have shown his lower back. The concussion from 18 months ago had warranted a CT scan of his head, but again, nothing that would have imaged the area where this object was located. But then she found what she was looking for. A chest CT from 3 years ago when Thompson had been treated for what was initially suspected to be pneumonia, but turned out to be a severe respiratory infection. The imaging field for that scan had extended down to include his upper abdomen, and there, barely visible at the edge of the scan, was the same metallic object. It's been there for at least 3 years, Dr. Kim realised, feeling a chill run down her spine. Whatever this object was, it had been inside Marcus Thompson's body for years, without him apparently knowing about it or seeking medical attention for it. She enhanced the image, using the hospital's advanced imaging software to get the clearest possible view of the foreign object. As the resolution improved and the details became sharper, Dr. Kim felt her blood run cold. The object wasn't a medical implant. It wasn't a piece of construction equipment that had somehow gotten lodged in Thompson's back during an accident. It was clearly, unmistakably, the barrel of a handgun. Dr. Kim sat back in her chair, staring at the computer screen in disbelief. After 12 years of radiology, she had developed the ability to identify foreign objects in the human body with remarkable accuracy. She had seen bullets, knife blades, pieces of glass, and every imaginable type of accident-related debris. But she had never seen anything like this. The gun barrel was positioned parallel to Thompson's spine, embedded in the muscle tissue in a way that would have required surgical precision to place. This wasn't something that had accidentally gotten into his body. It had been deliberately implanted, and the surgical technique required to do so suggested someone with considerable medical expertise. The implications were staggering. Someone, almost certainly a surgeon, had opened up Marcus Thompson's back and used his body as a hiding place for a murder weapon. The gun barrel had been carefully positioned to avoid major organs and blood vessels, indicating that whoever had done this possessed detailed knowledge of human anatomy. Dr. Kim's hands shook as she reached for her phone to call Dr. Chen in the emergency room. This was far beyond anything she had encountered in her medical career, and she needed guidance on how to proceed. Dr. Chen, this is Sarah Kim in radiology, she said when the emergency room physician answered. I need you to come up here immediately. We have a situation with the Thompson CT scan that you need to see. What kind of situation? Dr. Chen asked, her voice showing concern. Did you find something other than appendicitis? I found something that shouldn't exist, Dr. Kim replied. I can't explain it over the phone. You need to see this for yourself. 20 minutes later, Dr. Chen stood behind Dr. Kim's workstation, staring at the enhanced CT images with the same expression of disbelief that Dr. Kim had experienced earlier. Are you absolutely certain about what we're looking at? Dr. Chen asked quietly, as if speaking too loudly might somehow make the situation more real. I've triple-checked the image enhancement, looked at it from every possible angle, and compared it to reference images of various medical implants, Dr. Kim replied. There's no doubt about what this is. The question is how it got there and who put it there. Dr. Chen studied the positioning of the gun barrel, noting the surgical precision with which it had been placed. This required someone with advanced surgical skills, she observed. The placement is too precise, too careful to have been done by an amateur. Whoever did this knew exactly how to open the tissue, position the object, and close the incision without causing major complications. The two physicians discussed the legal and ethical implications of their discovery. They were legally obligated to report suspected criminal activity, but they also had a duty to protect their patients' medical privacy. The situation was unprecedented in both of their experiences. "We need to contact hospital administration and legal counsel," Dr. Chen decided. "This is beyond medical ethics. We're potentially looking at evidence of a serious crime. But we also need to figure out what this means for Thompson's current medical care." Dr. Kim had been thinking about the same issue. "His appendicitis symptoms are real and urgent," she said. "He needs surgery regardless of what else we've found. But any surgeon who operates on him is going to encounter this object, and we need to be prepared for that situation." The implications extended beyond just the immediate medical care. If the gun barrel was evidence of a crime, removing it could compromise a potential criminal investigation. But leaving it in place during abdominal surgery could complicate the operation and potentially endanger Thompson's life. "There's something else, Doctor," Kim added, pulling up Thompson's employment records that were part of his hospital file. "He works construction, but according to his insurance information, he's employed by Chen and Associates Construction Company. That's owned by Dr. Michael Chen." Dr. Chen's face went pale. Dr. Michael Chen was the chief of surgery at Metropolitan General Hospital, a highly respected surgeon who had been with the hospital for over 15 years. The possibility that he might be involved in whatever had happened to Marcus Thompson was almost too disturbing to contemplate. "We need to be very careful about how we handle this information," Dr. Chen said quietly. "If Dr. Chen is involved, we could be dealing with a conspiracy that goes to the highest levels of the hospital administration." Within 2 hours of Dr. Kim's discovery, Metropolitan General Hospital was swarming with law enforcement officers. Detective Lisa Rodriguez, a 15-year veteran of the Homicide Division, had been called in to oversee what was being described as one of the most unusual criminal cases in the city's history. Detective Rodriguez had investigated hundreds of murders, but she had never encountered a case where the weapon had been hidden inside a living person's body. The implications were staggering, not just for the specific crime that the gun barrel might represent, but for the broader questions it raised about medical ethics and the potential for healthcare professionals to abuse their positions. "I need to understand exactly what we're looking at," Detective Rodriguez said as she studied the CT scans alongside Dr. Kim and Hospital Administrator Janet Walsh. "How certain are you that this is part of a firearm?" "The imaging is conclusive, Doctor," Kim replied, pointing to the enhanced views on her computer screen. "The density, the shape, the dimensions, everything matches the specifications of a handgun barrel. Based on the size and configuration, I'd estimate it's from a .38 caliber revolver." Detective Rodriguez made notes in her investigative pad, already thinking about the database searches she would need to conduct to find unsolved murders involving .38 caliber weapons. The 3-year time frame gave her a specific window to focus on, but she knew that narrowing down the possibilities would still be a massive undertaking. "What about the surgical technique?" she asked. "How skilled would someone need to be to do this?" Dr. Walsh, who had been listening to the discussion with growing alarm, answered that question. This level of surgical precision would require someone with extensive medical training, she said. We're talking about someone who understands anatomy, surgical techniques, anesthesia protocols, and post-operative care. This isn't something that could be done in a garage or a basement. It would require proper surgical facilities. The detective's next question was the one that everyone had been dreading. Do we have any idea who might have had access to Thompson and the surgical capabilities to do this? Dr. Walsh pulled up Thompson's medical records on her tablet, scrolling through 3 years of hospital visits. Thompson has been treated by multiple physicians during his visits here, she said. Emergency room doctors, orthopedic surgeons for his broken arm, neurologists for his concussion, and various specialists for his other injuries. But one name appeared more frequently than others in Thompson's medical records: Dr. Michael Chen, who had been the attending surgeon for Thompson's broken arm repair and had also consulted on his concussion case when there were concerns about potential brain bleeding. Dr. Chen would have had multiple opportunities to access Thompson under surgical conditions, Dr. Walsh admitted reluctantly. He's also one of our most skilled surgeons, certainly capable of the technique we're seeing here. Detective Rodriguez requested a complete list of all medical personnel who had treated Thompson over the past 3 years, along with their schedules and any records of after-hours access to surgical facilities. She also wanted security footage from the hospital's surgical wing for any dates when Thompson had been treated. I need to interview Thompson himself, the detective said. Does he have any idea that he's been carrying a gun barrel around in his body for 3 years? Dr. Chen, who had been coordinating Thompson's emergency care while the investigation unfolded, shook her head. He's completely unaware. We've told him that his CT scan showed some unusual findings that require further investigation, but we haven't given him specific details. He's more concerned about his appendicitis symptoms than anything else. The detective realised that she was facing a delicate situation. Thompson was simultaneously a potential victim of a serious crime and an unwitting accomplice in concealing evidence. How he was approached and questioned could significantly impact both his medical care and the criminal investigation. I want to talk to him before any surgery takes place, Detective Rodriguez decided. If we're going to remove this object, I need to understand how it got there and whether Thompson has any knowledge of the circumstances surrounding its placement. Marcus Thompson sat in his hospital bed, connected to an IV drip, and wearing the kind of expression that came from hours of increasing pain, combined with confusion about why his simple appendicitis case had suddenly attracted the attention of hospital administrators and police detectives. Detective Rodriguez had interviewed thousands of witnesses and suspects over her career, but she had never questioned someone who was unwittingly carrying evidence of a potential murder inside his body. The situation required delicacy, compassion, and a careful balance between gathering information and providing emotional support. Mr. Thompson, I'm Detective Rodriguez with the Metropolitan Police, she began, pulling up a chair next to his bed. I need to ask you some questions about your medical history, specifically about any surgeries or medical procedures you've had over the past few years. Thompson looked confused. "I thought this was about my appendix," he said, shifting uncomfortably as another wave of pain hit him. "The doctors said they needed to do some kind of scan, but no one's telling me what's going on." "We're going to take care of your appendicitis," Detective Rodriguez assured him. "But during your CT scan, the doctors found something unexpected that we need to understand. I want you to think carefully about any time in the past 3 years when you might have had surgery, even minor procedures, or any time when you were unconscious for medical reasons." Thompson frowned, trying to remember through the haze of pain medication he'd been given. "I broke my arm about 2 years ago at a construction site. Had to have surgery to put in some metal plates. Then I had that concussion last year when a beam fell on my hard hat. Spent the night in the hospital for observation." "Tell me about the arm surgery," Detective Rodriguez requested, making notes about the timeline. "Do you remember anything unusual about that experience? How long were you under anesthesia? How did you feel when you woke up?" "It was pretty routine, I think," Thompson replied. "Dr. Chen, he's the surgeon here, said it was a straightforward procedure. I was under anesthesia for maybe 2 hours. When I woke up, my arm was in a cast and I had some pain in my back, but they said that was normal from lying on the operating table for so long." Detective Rodriguez felt her pulse quicken. Back pain after arm surgery wasn't necessarily normal, especially if it persisted. "How long did the back pain last?" she asked. "Several days," Thompson said. "Maybe a week." "I mentioned it to Dr. Chen during my follow-up appointment, and he said it was muscle strain from the positioning during surgery. Prescribed some pain medication and muscle relaxers. It eventually went away." The detective realized that Thompson's back pain had likely been the result of the surgical incision required to implant the gun barrel. Dr. Chen had apparently used Thompson's legitimate arm surgery as cover for an entirely different and illegal surgical procedure. "Mr. Thompson, I need to explain something to you that's going to be very difficult to understand," Detective Rodriguez said gently. "During your CT scan today, the doctors found a foreign object in your back that shouldn't be there. It appears to have been placed there surgically, probably during one of your previous hospital visits." Thompson's expression shifted from confusion to alarm. "What kind of foreign object?" he asked, his voice rising slightly. "We believe it's part of a firearm that was hidden in your body without your knowledge or consent," the detective explained, watching Thompson's face for any sign of deception or prior knowledge. "You've been carrying this object around for approximately 3 years. The colour drained from Thompson's face as he processed what he was being told. "Someone put a gun inside my body?" he said, his voice barely above a whisper. "How is that possible? Why would someone do that?" Detective Rodriguez spent the next hour walking Thompson through everything they knew about his situation. She explained the CT scan findings, the surgical precision required to place the object, and the timeline that suggested it had been implanted during his arm surgery 3 years earlier. Thompson's reactions seemed genuine: shock, disbelief, anger and fear as he realized that he had been violated and used as an unwitting accomplice in concealing evidence of what was likely a serious crime. "Dr. Chen did this to me?" Thompson asked, struggling to accept the possibility. "But he's been my doctor for years. He fixed my arm, took care of me when I had the concussion. Why would he use me like this?" That's what we're trying to figure out, Detective Rodriguez replied. But right now, we need to focus on your immediate medical needs and on safely removing this object so we can investigate the crime it might be connected to. The discovery of the gun barrel created an unprecedented medical and legal dilemma for Metropolitan General Hospital. Thompson's appendicitis was real and urgent. Delay in treatment could lead to a ruptured appendix, peritonitis, and potentially life-threatening complications. But removing the gun barrel during surgery could compromise crucial evidence in what was likely a murder investigation. Dr. Patricia Williams, the hospital's chief medical officer, convened an emergency meeting that included Detective Rodriguez, the hospital's legal counsel, representatives from the district attorney's office, and the surgical team that would be responsible for Thompson's care. "We have competing priorities here," Dr. Williams explained to the assembled group. "Our primary obligation is to provide necessary medical care to our patient. But we also have a legal obligation to preserve evidence and cooperate with law enforcement." The legal implications were complex and largely unprecedented. The gun barrel was clearly evidence of a crime, but it was also a foreign object in a patient's body that could potentially complicate his surgery. Removing it might be necessary for medical reasons, but doing so could alter or contaminate the evidence in ways that might compromise a criminal investigation. Detective Rodriguez had consulted with forensic experts from the FBI's crime lab, who had provided guidance on how to handle the evidence if it needed to be removed. "We can preserve the evidentiary value if the removal is done under controlled conditions," she explained. "We need a forensic photographer present during the surgery, chain of custody documentation, and the object needs to be handled according to evidence protocols." Dr. Jennifer Lee, the surgeon who would be performing Thompson's appendectomy, raised another concern. "The gun barrel is positioned very close to major blood vessels and nerve clusters," she said, pointing to the CT scans. "Removing it will significantly complicate the surgery and increase the risks to the patient." We're talking about extending what should be a routine 30-minute procedure to potentially several hours. The ethical questions were just as complex as the legal ones. Did the hospital have the right to extend Thompson's surgery and increase his risks in order to remove evidence that he had never consented to having placed in his body? Was it ethical to leave the object in place when it represented such a clear violation of medical ethics and patient autonomy? Hospital legal counsel Margaret Foster had been researching similar cases and found virtually no precedent for the situation they were facing. The closest analogies involve cases where patients have accidentally swallowed evidence of crimes, she explained. But this is different because the evidence was placed deliberately and without the patient's knowledge by someone in a position of medical authority. The district attorney's office wanted the evidence preserved and removed if medically feasible. Detective Rodriguez needed the gun barrel to compare against ballistics evidence from unsolved murders. But everyone agreed that Thompson's life and health had to be the primary consideration. After 2 hours of discussion, the group reached a compromise decision. Dr. Lee would perform the appendectomy as scheduled, but with a forensic team present to document everything. If the gun barrel could be safely removed without significantly increasing the surgical risks, it would be extracted and turned over to law enforcement. If removal would endanger Thompson's life or health, it would be left in place until he could undergo a separate surgical procedure specifically designed to extract it safely. The patient's life comes first, Dr. Williams concluded, but if we can safely recover this evidence during necessary surgery, we have an obligation to do so. Thompson, still grappling with the reality of his situation, gave his consent for the expanded surgical procedure after extensive discussions with the medical team, Detective Rodriguez, and a patient advocate who had been assigned to ensure his rights were protected throughout the process. Thompson's surgery began at 8 p.m. on a Tuesday evening, with an unusual collection of observers present in the operating room. In addition to the normal surgical team, the OR included Detective Rodriguez, a forensic photographer, an FBI evidence specialist, and Dr. Michael Chen, who had been brought in under police surveillance to assist with the procedure. Dr. Chen's presence was both necessary and controversial. As the surgeon who had performed Thompson's original arm surgery, he had the most detailed knowledge of Thompson's anatomy and the positioning of the foreign object, but he was also the prime suspect in whatever crime the gun barrel represented. Dr. Chen will assist with the procedure under direct supervision, Dr. Williams had explained to Thompson before the surgery. His expertise may be necessary to safely remove the object, but he will not be in charge of your care, and law enforcement will be monitoring his every action. Dr. Lee began with Thompson's appendectomy, removing the inflamed organ through a minimally invasive laparoscopic procedure. The appendix was severely inflamed and likely would have ruptured within hours, confirming that the surgery had been medically necessary regardless of the other circumstances. With the appendectomy complete, Dr. Lee turned her attention to the more complex task of accessing the gun barrel. The object was embedded in Thompson's back muscles, requiring a separate incision and careful dissection to avoid damaging surrounding tissue. "I can see the object, Doctor," Lee announced as she carefully separated the muscle fibres. "It's wrapped in some kind of synthetic material, probably to prevent tissue reaction and make it harder to detect on routine scans." The forensic photographer documented every step of the procedure, capturing the exact position of the object and the condition of the surrounding tissue. Detective Rodriguez watched intently, knowing that every detail could be crucial to understanding how and why the gun barrel had been placed in Thompson's body. As Dr. Lee carefully extracted the object, Dr. Chen's reactions were being closely monitored by Detective Rodriguez and the FBI agent present in the OR. She was looking for any signs of recognition, surprise, or guilty knowledge that might provide clues about his involvement. The object appears to be the barrel of a .38 caliber revolver, Dr. Lee announced as she placed it in a sterile evidence container. "It's been modified. The trigger mechanism and cylinder have been removed, leaving only the barrel and part of the frame." Detective Rodriguez felt a surge of excitement. A modified gun barrel suggested that someone had deliberately prepared the weapon to be hidden in this way, removing the parts that would be most recognizable while preserving the barrel that would contain ballistic evidence. But the most shocking discovery came when Dr. Lee examined the synthetic wrapping that had surrounded the gun barrel. "There's an inscription on this material," she said, using forceps to spread out what appeared to be a small piece of latex or silicone sheeting. The inscription, written in what looked like permanent marker, read, "For Detective James Morrison, from your loving partner, Dr. Michael Chen." The OR fell silent as everyone processed the implications of the message. Detective James Morrison was a well-known homicide detective who had been found shot to death in his apartment 3 years earlier. The case had never been solved, and the murder weapon had never been recovered. Dr. Chen's face had gone completely white, and he appeared to be having difficulty breathing. Detective Rodriguez immediately signaled the FBI agent, who moved closer to Dr. Chen while remaining unobtrusive enough not to interfere with the ongoing surgery. "Dr. Chen," Detective Rodriguez said quietly, "I think we need to have a conversation." Dr. Michael Chen was arrested immediately following Thompson's surgery, which had been completed successfully with no complications. Thompson was expected to make a full recovery from both his appendectomy and the removal of the foreign object, though he would require several weeks of rehabilitation to fully heal from the back incision. In the interrogation room at police headquarters, Dr. Chen initially maintained his innocence, claiming that he had no idea how the gun barrel had ended up in Thompson's body. But faced with the physical evidence, the inscribed message, and the timeline that clearly linked him to the crime, his story quickly began to fall apart. Detective Rodriguez had spent hours preparing for this interrogation, researching Dr. Chen's background, his relationship with Detective Morrison, and any potential motives for murder. What she discovered painted a picture of a respected surgeon with a secret gambling addiction and mounting debts to dangerous people. "Dr. Chen, we know you placed that gun barrel in Marcus Thompson's body," Detective Rodriguez began. "We have your handwriting on the wrapping material. We have evidence that you were the only surgeon with access to Thompson during the time frame when the object was implanted, and we have the murder weapon that killed Detective Morrison. What we don't know is why." Dr. Chen remained silent for several minutes, staring at his hands while his attorney whispered advice in his ear. Finally, he looked up at Detective Rodriguez with the expression of a man who had been carrying an enormous burden for years. "Jimmy Morrison was going to destroy my life," Dr. Chen said quietly. "He found out about my gambling debts, about the money I owed to Tony Castellano's organization. He was going to arrest me unless I provided information about other doctors who were involved with Castellano's money laundering operation." Detective Rodriguez knew about Tony Castellano, a mid-level organised crime figure who had been suspected of using legitimate businesses, including medical practices, to launder money from his illegal operations. The FBI had been investigating Castellano for years without being able to build a solid case against him. "So you killed Detective Morrison to protect yourself and Castellano?" Detective Rodriguez asked. "It wasn't supposed to happen like that," Dr. Chen said, his voice breaking slightly. "Jimmy came to my apartment that night to give me one last chance to cooperate. We argued, he threatened to arrest me immediately, and I panicked. I had a gun for protection. Living in debt to people like Castellano makes you paranoid about your safety." Dr. Chen described a struggle that ended with Detective Morrison being shot twice in the chest with Dr. Chen's .38 caliber revolver. Faced with a dead police detective in his apartment, Dr. Chen had used his medical knowledge to dispose of the evidence in a way that he thought would never be discovered. "I couldn't just throw the gun in a river or bury it somewhere," he explained. "Police can find weapons that are disposed of conventionally, but I realized that I could use my position as a surgeon to hide it in a place where no one would ever think to look. The plan had been diabolically clever. Dr. Chen had disassembled the revolver, keeping only the barrel that contained the ballistic evidence. When Marcus Thompson came in for arm surgery 2 weeks later, Dr. Chen had used the legitimate medical procedure as cover for implanting the gun barrel in Thompson's back. Thompson was perfect for what I needed, Dr. Chen continued. He was a regular patient. He worked in construction, so he was used to physical discomfort, and he trusted me completely. I knew he wouldn't question some back pain after surgery, and I knew he wasn't the type to seek multiple medical opinions or ask too many questions. Dr. Chen had carefully positioned the gun barrel to avoid major organs and blood vessels, then wrapped it in synthetic material designed to prevent tissue rejection and make it less visible on routine medical scans. He had planned to leave it there indefinitely, confident that it would never be discovered. The only reason we found it now is because Thompson needed a CT scan for his appendicitis, Detective Rodriguez pointed out. If he hadn't gotten sick, your plan might have worked forever. I know, Dr. Chen replied. For 3 years, I thought I had committed the perfect crime. Thompson never suspected anything. The police never found the murder weapon, and I continued my life and career as if nothing had happened. But the psychological toll of carrying such a secret had clearly affected Dr. Chen over the years. Hospital colleagues had noticed changes in his behavior, increased anxiety, difficulty sleeping, and a tendency to avoid cases that reminded him of his crime. Dr. Chen's confession opened up a much larger investigation that extended far beyond Detective Morrison's murder. The FBI's Organised Crime Unit, working with local homicide detectives, began examining Dr. Chen's connections to Tony Castellano's money laundering operation and looking for other healthcare professionals who might have been involved. The investigation revealed that Castellano had been using medical practices to launder money for nearly a decade, taking advantage of the large cash flows and complex billing systems that characterized modern healthcare. Doctors with gambling debts or other financial problems were recruited to participate in fraudulent billing schemes, unnecessary procedures, and other forms of medical fraud that generated clean money for Castellano's organization. Dr. Chen had been involved in the operation for over 5 years before Detective Morrison began investigating the connection. Morrison had been working undercover, posing as a patient with chronic pain to gather evidence about doctors who were prescribing unnecessary opioids as part of Castellano's drug distribution network. Morrison was getting close to exposing the entire operation, FBI agent Sarah Davis explained to Detective Rodriguez. His murder wasn't just about protecting Dr. Chen, it was about protecting a multi-million-dollar criminal enterprise that involved dozens of healthcare professionals and several hospitals. The investigation into Thompson's case led to the discovery of evidence that had been overlooked in Morrison's original murder investigation. Dr. Chen's apartment, which had been searched 3 years earlier, was re-examined using advanced forensic techniques that revealed traces of blood evidence that had been missed the first time. Dr. Chen's confession also provided crucial details about Castellano's organization that the FBI had been unable to obtain through other investigative methods. Faced with murder charges and the possibility of life in prison, Dr. Chen agreed to cooperate fully with law enforcement in exchange for a plea deal that would spare him the death penalty. Chen's cooperation is going to allow us to dismantle an entire criminal network, Agent Davis said. We're looking at RICO charges against Castellano and his associates, medical license revocations for dozens of corrupt healthcare providers, and recovery of millions of dollars in fraudulent Medicare and insurance billings. The case also prompted a comprehensive review of security protocols at Metropolitan General Hospital and other medical facilities in the area. The idea that a surgeon could use legitimate medical procedures to conceal evidence of serious crimes raised disturbing questions about oversight and accountability in healthcare settings. Marcus Thompson, meanwhile, was struggling to process the reality that he had been an unwitting participant in a murder cover-up for 3 years. The hospital had provided him with extensive counselling support and had agreed to cover all of his medical expenses related to the unauthorised surgery and its aftermath. I trusted Dr. Chen completely, Thompson said in an interview with Detective Rodriguez after his recovery. He saved my arm, took care of me when I was hurt, and I never had any reason to suspect that he was capable of something like this. It makes you wonder who you can really trust. Dr. Michael Chen's trial for the murder of Detective James Morrison became one of the most closely watched criminal cases in the city's history. The unusual circumstances of the case, a murder weapon hidden inside an unwitting victim's body for 3 years, attracted national media attention and raised unprecedented questions about medical ethics and criminal justice. The prosecution, led by District Attorney Margaret Foster, built their case around the physical evidence recovered from Thompson's body, Dr. Chen's detailed confession, and the broader context of the organised crime investigation that had motivated the murder. Dr. Chen violated every principle of medical ethics and human decency, Foster argued in her opening statement. He used his position as a trusted healthcare provider to commit murder, conceal evidence, and exploit an innocent patient who trusted him with his life and health. The defence team, recognising that the physical evidence was overwhelming, focused on arguing for a lesser charge of manslaughter rather than first-degree murder. They portrayed Dr. Chen as a man who had made a terrible mistake under extreme pressure from dangerous criminals, rather than a cold-blooded killer who had planned Morrison's murder. Dr. Chen was in an impossible situation, defense attorney Robert Martinez argued. He was being extorted by organised crime figures who threatened his life and the lives of his family members. What happened that night was a tragic accident, not a premeditated murder. But the prosecution's case was strengthened by the elaborate steps Dr. Chen had taken to conceal the murder weapon. The careful planning required to disassemble the gun, prepare Thompson for surgery, and implant the barrel during a legitimate medical procedure demonstrated premeditation that contradicted the defence's argument about an impulsive killing. Marcus Thompson testified for the prosecution, describing his experiences as Dr. Chen's patient and the trust he had placed in the surgeon who had betrayed him so completely. His testimony was particularly powerful because it highlighted the human cost of Dr. Chen's crimes beyond just Detective Morrison's death. Dr. Chen didn't just kill Detective Morrison, Thompson testified. He violated my body, used me as a storage facility for his murder weapon, and put my life at risk every day for 3 years. I could have died if that thing had shifted or caused an infection. He treated me like an object instead of a human being. The trial also featured extensive testimony from forensic experts who explained how the gun barrel had been matched to ballistics evidence from Morrison's murder scene. The inscription found on the wrapping material was confirmed to be in Dr. Chen's handwriting through detailed analysis by FBI document examiners. Dr. Patricia Williams, testifying for the prosecution, described the profound breach of medical ethics that Dr. Chen's actions represented. The doctor-patient relationship is built on absolute trust, she explained to the jury. Patients must believe that when they undergo surgery, their doctors have only their best interests at heart. Dr. Chen's actions represent the most serious violation of that trust imaginable. The jury deliberated for only 6 hours before returning a guilty verdict on charges of first-degree murder, evidence tampering, aggravated assault on Marcus Thompson, and conspiracy in connection with the organised crime investigation. Dr. Chen was sentenced to life in prison without the possibility of parole. Tony Castellano and 12 other members of his organisation were subsequently convicted on federal racketeering charges, with several receiving sentences ranging from 20 years to life in prison. The investigation led to the revocation of medical licenses for 23 healthcare providers and the recovery of over $15 million in fraudulent billings. The Chen case prompted sweeping reforms in hospital security protocols and medical oversight procedures. Metropolitan General Hospital implemented new safeguards designed to prevent unauthorised surgical procedures and ensure that all medical interventions were properly documented and supervised. We've completely overhauled our operating room security, Dr. Williams explained during a press conference 6 months after Dr. Chen's conviction. Multiple verification systems now ensure that no surgeon can perform unauthorised procedures, and all surgical activities are monitored by independent observers. The case also led to changes in how medical imaging results were reviewed and investigated. Dr. Sarah Kim, the radiologist whose careful examination had uncovered the hidden gun barrel, became an advocate for more thorough investigation of unusual findings on medical scans. We can't assume that strange shadows or unexpected objects are always benign, Dr. Kim said during a medical conference presentation about the case. As healthcare providers, we have an obligation to investigate thoroughly and ask difficult questions when something doesn't make sense. Marcus Thompson underwent extensive physical therapy to recover from the surgical removal of the gun barrel and received a substantial settlement from the hospital's insurance company. He also became an advocate for patient rights and medical oversight, working with legislators to strengthen protections against medical abuse. "What happened to me could happen to anyone," Thompson said during testimony before a state legislative committee examining healthcare reforms. Patients are vulnerable when they're under anaesthesia, and we need better systems to protect them from doctors who might abuse their position. The case had broader implications for the medical profession's self-regulation and oversight mechanisms. Medical boards across the country began implementing more rigorous background checks for surgeons and other healthcare providers, including financial investigations designed to identify doctors who might be vulnerable to corruption or coercion. Dr. Jennifer Lee, the surgeon who had performed Thompson's appendectomy and extracted the gun barrel, became a leading voice in the movement for enhanced medical ethics education. We need to do a better job of preparing doctors for the ethical challenges they might face, she argued. The temptation to abuse medical authority is real, and we need to give healthcare providers the tools they need to resist it. 3 years after Dr. Chen's conviction, the case continues to serve as a cautionary tale about the potential for abuse within the medical profession and the importance of vigilant oversight in healthcare settings. Marcus Thompson returned to construction work after his recovery, though he changed employers to avoid any remaining connections to Dr. Chen's criminal activities. He married his longtime girlfriend and became a father, describing his daughter as the best thing to come out of this nightmare. I learned that you can't take anything for granted when it comes to your health and safety, Thompson reflected during a recent interview. I still have to get regular medical care, but now I ask more questions and get second opinions. What happened to me changed how I think about trusting authority figures. Dr. Sarah Kim was promoted to Chief of Radiology at Metropolitan General Hospital and has been instrumental in developing new protocols for investigating unusual medical findings. Her careful work on the Thompson case is now used as a training example in radiology residency programs across the country. The Chen case taught us that radiologists have a responsibility that extends beyond just reading scans, Dr. Kim explained. We're often the first line of defense against medical fraud and abuse, and we need to take that responsibility seriously. The FBI's investigation into Tony Castellano's organisation led to the discovery of similar schemes in other cities, resulting in one of the largest healthcare fraud prosecutions in federal history. Agent Sarah Davis, who coordinated the investigation, estimated that the total recovery of fraudulent funds exceeded $50 million. The Chen case showed us how organised crime can infiltrate legitimate institutions, like hospitals, Agent Davis said. It's a reminder that corruption can occur anywhere, even in professions that we traditionally view as trustworthy and ethical. Detective Lisa Rodriguez, who had led the criminal investigation, was promoted to lieutenant and now heads a specialised unit that investigates crimes involving healthcare fraud and professional misconduct. The unit has become a model for other law enforcement agencies dealing with similar cases. The hidden gun barrel case was unlike anything we'd ever encountered, Rodriguez reflected. But it taught us important lessons about the intersection of medical authority and criminal behaviour. We now know to look for evidence in places we never would have considered before. The case also had lasting impacts on medical education and training. Medical schools across the country now include mandatory courses on professional ethics and the potential for abuse of medical authority. The Chen case is frequently cited as an example of how personal problems and criminal pressures can lead healthcare providers to violate their most fundamental professional obligations. Perhaps most importantly, the case served as a reminder that the doctor-patient relationship, while built on trust, requires constant vigilance and oversight to prevent abuse. The reforms implemented in the wake of Dr. Chen's crimes have made similar violations more difficult to commit and easier to detect. Trust is essential in medicine, Dr. Williams concluded in her final report on the case. But trust without accountability is dangerous. The Chen case taught us that even the most respected professionals can fall victim to corruption, and we need systems in place to protect patients from those who would abuse their position. For 3 years, Marcus Thompson unknowingly carried the evidence of Detective Morrison's murder inside his body. A victim of a crime he didn't even know had been committed against him. His case became a symbol of both the potential for abuse within trusted institutions and the power of careful, ethical professionals to uncover the truth and ensure justice is served. The strange shadow on Thompson's CT scan that Dr. Kim had investigated so carefully turned out to be more than just an unusual medical finding. It was the key to solving a murder, exposing a criminal conspiracy, and implementing reforms that would protect countless future patients from similar violations of trust. Sometimes the most important discoveries are hiding in plain sight, waiting for someone with the skills, dedication, and courage to look closely enough to see what others have missed. Like if this story shocked you about medical ethics violations. Subscribe for more medical crime investigations. Comment on the importance of oversight in healthcare.